in reference to immunotherapy and CAR T-cell therapy, who are these types of treatments right for?
So I think it's really exciting that we finally are getting standard of care therapies for all these new immune therapies. So, our first CAR T for myeloma got approved a little over a year ago. Our second CAR T got approved just a couple of months ago. And we're hoping our first bispecific will be approved in just a couple of months. We're fingers crossed. But really, our patients who on the clinical trials, I will say, patients who had a good performance status, meaning, they're able to do everything else they can't, normally life-wise, did the best. Those are the patients that got onto those clinical trials. And the reason is safety-wise. So T cells, when we use them to kill myeloma, they release cytokines or enzymes, you can say, that are inside the T cells. And that's what they use to communicate with other immune cells to come help them kill. Those are the same cytokines that make people feel really ill when they have the flu, for instance. So as our immune system tries to fight infections, when people get fevers, they feel chills, they feel, just fatigued and tired, it's the same type of cytokines that even when you try to kill the myeloma with T cells, people can get that same type of, symptoms. And really, the main fevers, things like that, we can take care of. But when patients' blood pressure drops, or if their oxygen levels drop really low, that's where we can run into some trouble. Now, the good news is in myeloma, most of these new therapies don't cause really bad CRS or really bad neurotoxicity that we can sometimes see. And so thankfully, most patients are okay, but really it's making sure that none of our patients have bad toxicity. So most of our myeloma patients, I will say, are eligible for these therapies. However, if someone has really bad heart disease or really bad lung disease, those are patients that maybe these are not the right therapies for.